persistently elevated blood sugar glucose level are an indicator of diabetes mellitus, a chronic metabolic disease caused by the body's incapacity to either make enough insulin or use it efficiently, or both. The pancreas secretes the hormone insulin, which helps cells absorb glucose for energy. Hyperglycemia results from an accumulation of glucose in the bloodstream caused by an impairment in this mechanism. Polydipsia, excessive thirst, polyuria, frequent urine, weariness, hazy eyesight, wound that heal slowly, and inexplicable weight loss are all signs of diabetes. Diabetic retinopathy, kidney damage, nerve damage, and cardiovascular disease are among the major complications that can arise from diabetes if left untreated. Blood sugar monitoring, lifestyle changes, and medicinal intervention are all part of management, while type 2 diabetes can be controlled with insulin, injectable pharmaceuticals, or oral medication, in addition to a balanced diet, consistent exercise, and weight control. Type 1 diabetes necessitates insulin therapy to avoid problems and enhance quality of life. Early diagnosis and appropriate treatment are essential. Type 1 and type 2 diabetes are the two main forms of diabetes mellitus. Though there are other varieties as well, insulin-producing beta cells in the pancreas are destroyed by the immune system in type 1 diabetes, code E10, and autoimmune disease that result in little or no insulin production. This kind of necessitates lifelong insulin therapy and typically appear in childhood or adolescence. Usually developing in adulthood, type 2 diabetes, code E11, is more prevalent. It happens when the pancreas is unable to produce enough insulin or when the body develops resistance to it. Obesity, a sedentary lifestyle, family history, and poor eating habits are risk factors for type 2 diabetes.
For case study 1, I will present a case involving a 45-year-old man with type 2 diabetes, diagnosed 6 years ago, who has been on insulin therapy for the past 2 years. He presented with uncontrolled hyperglycemia and a significant increase in insulin dosage over the last 5 months. Upon evaluation, it was noted that he had no history of fever, infection, or steroid use, yet his blood glucose level remained poorly controlled. Physical examination revealed lipohypertrophy, which is an abnormal fatty tissue growth on the medial aspect of his thigh, where he has been injecting insulin repeatedly, impairing insulin absorption and contributing to the increased insulin requirement. This oversight occurs in a busy clinic setting with limited access to trained diabetes educators. Based on this case, the following ICD-10 code were assigned: T38.3X5, indicating an adverse effect of insulin therapy due to improper absorption linked to lipohypertrophy; E11.65 for type 2 diabetes mellitus, complicated by hyperglycemia resulting from inconsistent insulin absorption. Next code is E88.2, reflecting the presence of lipohypertrophy as a form of lipomatosis at the injection site. And the last code is Z79.4, denoting the patient's long-term use of insulin. This case underscores the critical importance of proper injection technique, regular rotation of injection site, and patient education in achieving effective diabetes management and preventing complications like this.
Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Arif Ahmad bin Khalil Soekarno. For case study number 2, a 55-year-old obese man with type 2 diabetes for 12 years, who has been on insulin for 6 months, experienced erratic blood glucose level despite increasing his dose. He skipped breakfast and overate at lunch on testing days, leading to insufficient insulin coverage and high postprandial glucose levels. To improve his management, he was advised to divide his meals, take Vognibus before meals, and adjust his insulin regimen to include regular insulin before breakfast and lunch, and premix insulin before dinner. These changes successfully control his blood glucose level. In this case study, the patient's primary diagnosis is E11.65, a type 2 diabetes mellitus with hyperglycemia, which is the main reason for his medical visits and treatment adjustment. The secondary diagnosis is E66.9, obesity that are unspecified. This code is important as it provides context about the patient weight status, which can affect diabetes management. Next is Z79.4, a long-term current use of insulin. This code indicates the patient's current treatment regimen, which is essential for understanding his diabetes management. Also recorded R73.09, other abnormal glucose code, also been recorded. This code captures the disorders between the patient A1C and blood glucose readings, which is a significant aspect of his clinical picture. And lastly, Z71.3, dietary counseling and surveillance. This code reflects the dietary counseling provided to the patient, which was a key part of his management plan and necessary for addressing his irregularities in meal timing and intake. That's all from me. Thank you.
Assalamualaikum. Hi, my name is Muhammad Zakaria. I'm the next presenter. So next we will go through to the next slide, which is the case study number 3. So without further ado, let's start. A man with type 2 diabetes, which is code is E11.65, which is for type 2 diabetes mellitus with hyperglycemia, who have been taking insulin for the past 4 years with a good glycemic control, which is Z79, 0.4, known as long-term use of insulin, was started on twice daily premix insulin with a pen device for the past month. Although he was happy with the convenience and ease of using pen device, his blood glucose levels became erratic. We decided to confirm his injection technique and asked him to bring his pen device to the clinic. He brought a pen device with a cartridge in place, but the needle was missing. On questioning, we learned that the patient was injected insulin without a needle. He thought it normal that he would not feel anything because pen device were supposedly to be painless. In actuality, he was trying to give himself insulin transdermally rather than subcutaneously. This case illustrates that the combination of less than education, which is code is Z71.89, is for other specific counseling. And aggressive marketing by devices company can lead to misconception on the part of patient. So the erratic glycemic control and adverse outcome highlight the role of improper using of insulin, which is T38.3X5, which is for adverse effect of insulin and oral hyperglycemic drugs. So that's all for me. Next, I will pass to the next presenter. Thank you.
Hi, Assalamualaikum. My name is Irdina Harisa binti Zulkifli, and I'm going to explain about the case study number 4. So, the case study number 4 is a woman with type 2 diabetes mellitus E11.65 who had been on long-term insulin therapy Z79.4 for the past 6 years with reasonable glycemic control, presented with hyperglycemia, injection site abscesses and glucose fluctuations over the past month. On examination, she had nodular swellings and discharging sinuses at the injection sites, L98.8. Through detailed questioning, it was revealed that she had been wiping the insulin injection tip with a cotton swab before and after each injection, potentially leading to contamination. This was suspected to have caused an adverse reaction linked to the insulin vial, T38.3X5A, and the adverse effects were further classified as related to unspecified drugs or substances, T50.99 5A. Additionally, a possible unintentional poisoning by insulin T38.3X1 was considered. These findings highlight the need to address proper injection techniques and the impact of infection on glycemic control in patients using insulin.
To sum up, diabetes mellitus is a chronic and complicated illness that necessitates a deep comprehension of its form, causes, and treatment approaches. While type 2 diabetes, which is caused by insulin resistant or insufficient insulin production, is frequently brought on by modifiable lifestyle factors such as poor food, inactivity, and obesity. Type 1 diabetes and autoimmune illness require lifelong insulin therapy and attentive care. In all situations, efficient blood glucose management and the avoidance of serious consequences depend heavily on early diagnosis, lifestyle changes, and adherence to prescribed medication. People with diabetes can greatly enhance their quality of life, lower their chance of developing long-term health problems, and improve their general health outcome by taking a proactive and comprehensive approach.